Not drinking enough water can quietly aggravate the prostate without warning. While many seniors intentionally limit their fluid intake to reduce the number of nighttime bathroom trips, this seemingly harmless habit can set off a chain reaction that silently damages the prostate over time. When the body doesn't receive adequate hydration, urine becomes more concentrated. This concentrated urine is more acidic and irritating to the delicate tissues of the bladder and surrounding areas, including the prostate, which sits just beneath it. As the bladder becomes irritated, it sends more stress signals and physical pressure toward the prostate. Over weeks, months, or even years, this repeated strain contributes to inflammation, swelling, and eventually enlargement of the prostate gland. Doctors have observed this pattern in countless older patients, not due to aging alone, but due to overlooked daily habits like chronic dehydration. In fact, many men over 60 are unknowingly exacerbating their urinary symptoms by underhydrating throughout the day. Dehydration isn't always obvious. Seniors often don't feel thirst as sharply as they used to, which means they may not realize how little water they're drinking. Furthermore, medications commonly prescribed in later life, such as those for blood pressure, heart disease, or mood disorders, can cause additional fluid loss. Without intentionally replenishing those fluids, the body falls into a cycle of mild but chronic dehydration. This puts stress on all systems, especially the urinary tract. The kidneys must work harder to filter toxins, and the bladder ends up storing more irritating waste compounds in concentrated urine. The prostate, sitting in the path of this stress, begins to react with low-grade inflammation, an early but critical step toward benign prostatic hyperplasia, BPH, which is the enlargement of the prostate gland. Over time, this low-level inflammation becomes a persistent condition. It restricts normal urinary flow and can cause symptoms such as difficulty starting or stopping urination, a weak stream, or the need to urinate multiple times throughout the night. These issues are often accepted as an unavoidable part of aging, but in many cases, they're preventable. Some physicians believe that consistent hydration could significantly reduce the frequency and severity of these symptoms. When the body is hydrated, urine remains diluted. Diluted urine is far less irritating to the bladder lining and the prostate. This reduces the stress response from surrounding tissues and allows the urinary system to function more smoothly and with less inflammation. Hydration also plays a critical role in detoxification. A dehydrated body struggles to eliminate waste efficiently. Toxins and metabolic byproducts that should be flushed through the urine can linger in the bloodstream or concentrate in the urinary tract, creating further stress for the kidneys and bladder. When these toxins come into contact with the already sensitive and inflamed prostate tissue, the results are often worse. More swelling, more irritation, and over time, more enlargement. The damage accumulates slowly but steadily. Seniors who regularly underhydrate may find themselves caught in a frustrating cycle of urinary discomfort that grows worse with time, even as they continue reducing water intake in hopes of avoiding symptoms. Medical experts frequently recommend small, steady hydration throughout the day as a preventive strategy. This doesn't mean drinking large amounts all at once. In fact, doing so can overload the bladder and cause urgency. Instead, sipping moderate amounts of water every hour helps keep the urinary system balanced. The goal isn't just to reduce thirst, but to maintain a clear or light yellow urine color, a basic, visible indicator of proper hydration. It's a simple yet powerful tool that can be monitored daily without the need for lab tests or prescriptions. When the bladder is well hydrated, it operates more efficiently, empties more completely, and sends less pressure downward to the prostate. This keeps the prostate in a more relaxed, less inflamed state, reducing the chances of enlargement or urinary complications. Importantly, drinking more water does not necessarily mean more bathroom trips at night. When fluids are spaced out consistently through the day and reduced in the evening hours, ideally stopping 1-2 hours before bedtime, the body is less likely to wake during the night with urgency. Many seniors avoid water all day only, to feel intense thirst in the evening, leading to late fluid consumption that disrupts sleep. Reversing this habit can improve both prostate health and nighttime rest. Doctors often advise patients to front-load hydration, prioritizing water intake during breakfast and lunch hours when the body is most active and can process fluids efficiently. In cases where men are already experiencing prostate symptoms, improving hydration is often part of the first step in non-medication management. It's one of the least invasive and most effective adjustments to reduce irritation in the urinary tract. This change supports not only the prostate, but also the kidneys, bladder, and entire urinary system. For seniors with mild symptoms, this one shift alone can provide noticeable relief within days or weeks. The tissues become less inflamed, urine flows more easily, and nighttime interruptions may reduce without the need for medication. Hydration may not be seen as a formal treatment, but it's an essential foundation of long-term prostate care. Even in clinical settings, patients with chronic urinary issues are asked to keep hydration logs. When symptoms spike, doctors often first check how much water the person is actually consuming. Surprisingly, it's often far less than recommended. A good daily baseline is around 6 to 8 cups of water, adjusted for individual body size, climate, and medical conditions. But the key is consistency. Waiting until thirst becomes strong is already too late, especially for aging bodies with slower response times. Instead, consistent sips, even a few ounces at a time, help maintain internal balance and reduce urinary tract irritation that can worsen BPH. Seniors who have limited mobility or cognitive decline face additional challenges in staying hydrated. In such cases, caregivers play a critical role in offering water regularly and recognizing signs of dehydration, such as dry mouth, dark urine, confusion, or fatigue. Addressing hydration early can prevent not only prostate issues, but also other complications such as urinary tract infections, kidney stones, and general decline in wellness. Proactive attention to water intake is a small act with disproportionately large benefits. Staying properly hydrated should be seen not as a task, but as a daily habit of self-care. It's a cornerstone of healthy aging, especially for men over 60. The prostate may be small, but its impact on comfort, sleep, and daily life is significant. Supporting it with water is one of the simplest, safest, and most natural ways to reduce stress on the gland and avoid unnecessary enlargement. Over time, this can mean fewer interruptions during the night, more comfort during the day, and a lower risk of complications that may require invasive treatment. It starts with something as simple as a glass of water. Not too much, not too late, but just enough and just in time. When hydration is taken seriously, prostate health is no longer left to chance. It's supported, protected, and strengthened every single day. Sitting for extended periods may feel restful, but for the aging male body, it silently places harmful pressure on the prostate and surrounding organs. The prostate gland is nestled deep within the pelvis, just beneath the bladder and around the urethra. When a person remains seated for long stretches, especially without taking standing or walking breaks, this central region endures constant compression. Over time, the persistent pressure restricts blood circulation in the pelvic area, including the vessels that nourish the prostate. Reduced blood flow means less oxygen, fewer nutrients, and a slower ability to remove waste products from the tissues. These conditions create a favorable environment for inflammation to develop, and chronic inflammation is a key contributor to benign prostatic hyperplasia, or BPH, the gradual enlargement of the prostate that affects many men over 60. Medical researchers have observed a growing connection between sedentary behavior and increased prostate size. The problem is not just limited to those with limited mobility or illness. Even men who feel generally healthy but spend their days watching television, using a computer, or reading for hours without interruption may unknowingly be triggering prostate changes. The body is designed for movement, and when it's denied this essential function, organs suffer. in the lower abdomen and pelvic region, where blood circulation is already somewhat limited due to anatomical structure, prolonged sitting compounds the issue. The longer a man stays seated without shifting or standing, the more stagnant the blood becomes in that region. Stagnant circulation leads to oxygen-starved tissues and a rise in local inflammation, a hidden but powerful risk factor for prostate problems. It's not just about pressure and circulation. Immobility also affects muscle function, particularly the pelvic floor muscles. These muscles are critical for controlling urination and supporting the bladder and prostate. When a man remains inactive for most of the day, the pelvic floor weakens. A weak pelvic floor makes it more difficult to fully empty the bladder during urination. This means residual urine remains in the bladder longer than it should, increasing the risk of bacterial growth, bladder irritation, and further strain on the prostate. Over time, these conditions can snowball. What begins as subtle urinary frequency or difficulty initiating a stream can progress into persistent discomfort, interrupted sleep, and ongoing enlargement of the gland. Standing or walking at regular intervals can significantly ease this pressure. Even light activity such as stretching, taking a brief walk down the hallway, or performing gentle movements while seated can help stimulate circulation and reduce congestion in the pelvic area. Movement doesn't have to be strenuous to be effective. For seniors especially, low-impact activity can deliver high-impact benefits. Medical guidelines increasingly encourage men over 60 to break up periods of sitting with movement every 30 to 60 minutes. These simple actions keep the pelvic region oxygenated, improve lymphatic drainage, and reduce the buildup of inflammatory markers in the prostate region. The goal is not to eliminate sitting, rest is necessary, but to balance it with intentional movement that protects prostate health. Doctors emphasize that it's not only the quantity of time spent sitting, but the continuity of it that matters. A man who sits for 8 hours straight without moving is at greater risk than someone who sits for 10 hours, but includes short walking breaks each hour. The act of standing and moving alters internal pressure, activates muscles, and helps regulate fluid movement in the body. In practical terms, this means a man who takes 2-minute walks around the house every hour may be actively defending himself against prostate swelling, even if he otherwise leads a quiet lifestyle. Small, repeated movements are enough to prevent stagnation and keep inflammation in check. For many, this is one of the simplest lifestyle changes that brings a real return in comfort and urinary performance. Another important aspect is posture. Seniors often slump or lean back while sitting, especially in recliners or soft couches. This positioning tilts the pelvis in a way that increases pressure on the prostate and restricts the natural curve of the spine, which can influence nerve function to the pelvic organs. Over time, poor posture further restricts blood flow and compresses organs in unnatural ways. Sitting upright, using a supportive chair, or placing a cushion to support the lower back can relieve this downward pressure. Alternating between sitting surfaces, a soft couch, a firm chair, or a padded stool, also helps distribute weight more evenly and prevents prolonged compression of a single area. The concept of inflammation from stillness is becoming more prominent in medical discussions, particularly in the context of aging. Inflammation doesn't always result from injury or infection. Sometimes it builds slowly due to inactivity, limited movement, and poor circulation. The prostate is uniquely vulnerable because it's surrounded by dense structures and relies on consistent blood flow to maintain balance. Once inflammation begins, it can silently escalate, causing tissue to swell and cells to change. For some men, this leads to mild symptoms. For others, it becomes a chronic issue requiring medication or even surgery. Regular movement, short, consistent, and low impact, can act as a natural anti-inflammatory strategy, reducing the need for interventions down the line. Furthermore, studies suggest that men who engage in even light daily activity tend to report fewer nighttime bathroom trips and better urinary flow. These improvements are not always dramatic overnight changes, but rather gradual shifts that come from restoring a healthier internal environment. Regular activity supports metabolism, improves hormone balance, and reduces abdominal fat, all of which indirectly benefit the prostate. The habit of moving doesn't need to feel like exercise. Walking to the kitchen, stretching arms above the head, rotating ankles, or simply standing during phone calls can all add up. The key is to avoid long hours of stillness, especially in positions that concentrate pressure on the lower abdomen and pelvic floor. In institutional settings such as care homes or assisted living facilities, movement is often restricted by routine. But health professionals emphasize the importance of integrating movement breaks into daily schedules. Whether it's assisted walking, guided stretching, or structured mobility programs, each action contributes to maintaining pelvic health. The same principles apply at home. For men over 60, it's not about athletic performance, but about strategic, protective movement that aligns with how the body ages and what it needs to function well. Ignoring this can allow preventable conditions to develop, leading to reliance on medication, interrupted sleep, and a reduced quality of life. Finally, movement is not just physical. It stimulates mental engagement, improves mood, and enhances coordination. These benefits further reduce the indirect risks to prostate health. A more mobile person tends to stay better hydrated, eat healthier, and attend medical appointments more consistently. All of these secondary behaviors reinforce a healthier lifestyle and create a positive cycle of care. Sitting may seem harmless, but when it becomes the dominant state of living, it quietly builds problems that surface later. Regular movement interrupts this pattern and gives the prostate the support it needs to stay calm, balanced, and functional as men age. Drinking too much caffeine is one of the most overlooked daily habits that can quietly aggravate and enlarge the prostate, especially in men over 60. While a morning cup of coffee is part of many seniors' routines, repeated intake throughout the day, whether from coffee, black tea, sodas, or energy drinks, introduces a steady dose of a natural stimulant that puts added stress on the urinary system. Caffeine acts as a diuretic, meaning it increases urine production by stimulating the kidneys. This might sound harmless, but for a man dealing with an aging or already sensitive prostate, this increased urine flow demands more frequent trips to the bathroom and places consistent pressure on the bladder and the prostate itself. Medical research has long associated excessive caffeine consumption with increased urinary urgency, frequency, and even incontinence, all of which are common complaints among older men already navigating prostate challenges. The more caffeine consumed, the more the bladder is forced into a state of overactivity, which translates into more irritation for the surrounding tissue, including the prostate gland that sits just beneath it. This overstimulation leads to a chain of effects within the urinary tract. Caffeine not only boosts urine production, but also tightens the muscles surrounding the bladder and urinary sphincter. In simpler terms, it causes the body to contract these muscles more frequently and more forcefully, making it harder to relax and empty the bladder fully. When the bladder isn't emptied completely, small amounts of urine remain behind, and this leftover urine often becomes stagnant and irritating over time. The resulting pressure backs up toward the prostate, especially in men who may already be dealing with some degree of benign prostatic hyperplasia, or BPH. Over time, this continual strain can contribute to swelling, inflammation, and discomfort. While these changes may seem subtle at first, a little more urgency, a weaker stream, or one extra trip to the bathroom at night, they are often the early signs of a developing problem. When left unaddressed, they can escalate into larger prostate-related issues requiring medical intervention. Many seniors also don't realize that caffeine's effects are cumulative. It stays in the body for several hours, meaning that one cup in the morning may still be influencing bladder activity well into the afternoon. Adding a second or third cup only compounds the effect. Black teas, especially when brewed strong, contain similar levels of caffeine to coffee and can have the same diuretic properties. Soft drinks and energy beverages are often even worse. loaded not only with caffeine, but also with artificial sweeteners and acids that irritate the bladder lining. For someone with a sensitive or aging prostate, this cocktail of stimulants can quietly trigger chronic inflammation. Over time, these repeated inflammatory responses can enlarge the prostate's tissue, limit normal urinary flow, and disrupt the natural rhythms of bladder control. These aren't sudden symptoms. They build slowly, often unnoticed until they begin interfering with daily life and sleep quality. Sleep, in particular, is deeply affected by caffeine-induced prostate irritation. Men who consume caffeine too, late in the day, whether through an afternoon coffee, an evening tea, or even chocolate, often find themselves waking up multiple times during the night to urinate. This interrupts rest, weakens the body's healing response, and leads to daytime fatigue, which can further contribute to poor lifestyle habits that worsen prostate health. Doctors frequently warn against late-day caffeine for this reason, especially for patients over 60 who already report nocturia or nighttime urination. Reducing caffeine after lunch can help restore more continuous sleep and give the bladder and prostate the break they need overnight to reset and recover. The body uses sleep to reduce inflammation, rebalance hormones, and repair tissue, critical processes that are disrupted by caffeine-triggered bathroom trips. Hormonal balance is another key area influenced by caffeine. Studies have shown that high levels of caffeine consumption may interfere with the body's normal regulation of cortisol and testosterone. Cortisol, the stress hormone, rises with excess caffeine, and chronically elevated cortisol has been linked to increased inflammation throughout the body. For the prostate, this means more internal stress and greater likelihood of tissue swelling over time. At the same time, disrupted testosterone balance affects how the prostate grows and functions. Testosterone plays a central role in regulating the size and activity of the prostate, and even mild disruptions can have downstream effects, especially in older men whose hormone levels are already shifting with age. It's a subtle but important point. What's in the cup goes far beyond taste. It can influence fundamental processes that determine prostate health. Importantly, managing caffeine doesn't mean eliminating it entirely. For many men, moderate intake, such as one small cup of coffee in the morning, is perfectly fine. In fact, some research even suggests that very low doses of caffeine may have antioxidant properties. The key lies in moderation, timing, and balance. Switching to decaffeinated options, herbal teas or warm lemon water can offer comfort without the side effects. Green tea, when consumed in limited quantities, is often a better alternative, as it contains lower levels of caffeine and includes compounds like catechins that may even support prostate health. It's not about giving up routines that bring comfort, but about reshaping them in a way that supports the body's natural healing ability rather than fighting against it. Doctors who work with older men often advise tracking caffeine intake as part of managing urinary symptoms. Many patients are surprised to learn just how much caffeine they're consuming unknowingly. Certain medications, pain relievers, and even flavored waters or protein powders can contain caffeine. Reading labels and staying aware of total daily intake can make a noticeable difference. Some men find that simply reducing caffeine by half, switching from 2 cups to 1, leads to fewer nighttime trips to the bathroom and a more relaxed bladder throughout the day. That relief, in turn, reduces the pressure on the prostate and allows the body to maintain a more stable internal environment. Beyond physical symptoms, there's also a mental comfort in gaining control over daily habits. Excess caffeine can create a cycle of dependence. Sleep disruption leads to morning fatigue, which prompts more caffeine, which again leads to nighttime wakefulness. Breaking that loop starts with awareness and small changes. For the prostate, each reduction in stimulation, strain, and irritation creates more room for recovery and resilience. Hydration, balance, and gentle routines are more beneficial than any stimulant-fueled pattern. The body speaks clearly. It just needs someone to listen. A calm bladder, a rested night, and a healthy prostate are the result of consistently choosing what supports healing, not what works in the short term, but harms in the long run. Even in clinical observations, many urologists have noted improved urinary outcomes when patients are advised to limit caffeine alongside other conservative management strategies. This includes better flow rates, reduced urgency, and less dependence on medications designed to shrink or relax the prostate. While caffeine is rarely the sole cause of prostate issues, it often acts as a hidden amplifier, worsening pre-existing conditions and prolonging recovery. Seniors who reduce their caffeine intake often describe a new sense of ease throughout the day. Fewer bathroom interruptions, less discomfort, and more confidence when leaving the house or engaging in activities. These small improvements restore dignity, independence, and peace of mind, all of which are essential to a high quality of life as men age. Ultimately, the choice to reduce caffeine is not about denying pleasure, it's about restoring comfort. The prostate, though small, plays a large role in day-to-day well-being, especially after the age of 60. Respecting its needs means understanding what inflames it, what calms it, and what habits make the difference between discomfort and control. Caffeine, when overused, is a silent irritant. When managed, it loses its power to disrupt. For seniors looking to protect their prostate naturally, this may be one of the easiest and most effective places to begin. With each decision to swap a second cup of coffee for a glass of water or to switch to herbal tea in the afternoon, the prostate receives a message: you are being protected. Over time, that message becomes measurable, not just in symptom relief, but in better nights, stronger days, and healthier years ahead.